I retired from the VA a couple of years ago, and my primary area of research is to look at large data sets, electronic health record data, and look at to see if the things that clinical research had told us are effective and see if they truly are in day-to-day. We are looking at data that will show us people who have used silver diamine fluoride, and they use it a lot in children. And so what we're doing is we're looking to see how well it works in adults. There have been some small studies in adults, but in the VA, we've been using it for about the last 10 years, and we've used recommendations and tried to use it correctly. So now we want to see, does it really help patients not have teeth taken out later, help them not have as many restorations? Silver diamine fluoride arrests. And so there is a preventive property to it because there's fluoride in it. But the fluoride and the silver together literally will harden or arrest the lesion. It doesn't go away, but it also doesn't get worse. This will turn a cavity a real dark color. So we would never want to do that on front teeth for people, except under very specific circumstances. But if we do that for some smaller lesions, or maybe lesions that they're very difficult for us to fill, then we don't have to do a restoration on that tooth. And I think that patients would say, yes, any day to that. Some of us here at KCU are also looking at a study where we're looking at the emergency department visits for dental that happen here in Joplin. And we want to know if having a dental school here would really make an impact, because we know that when people go to the emergency room for dental issues, they don't usually get treatment. Maybe they get pain medicine or antibiotic, but it doesn't solve the problem. So what we hope is that patients will be able to come here before and be able to get dental treatment upstream so that maybe they won't have those toothaches. Or if they do, we have an urgent care clinic that is a place for them to go to get treatment. So we will have students working with us on that because we want to look at the data before in the emergency department and then a few years after as well to see if there's any change. But we also want our students to work with us to ask our patients who come here to the emergency clinic, have they been to the emergency room before? Or what kind of treatment did they get, how many times? So we're kind of putting all that together to see what effect that we can have that's hopefully a positive effect on the community.